anytime a patient comes in and has significant wear on their front teeth or maybe all of their teeth, it's a big red flag. And some of it is age dependent. So if you've got somebody that's 80 with worn teeth versus somebody that's 40 with worn teeth, really is more significant for the patient that's younger. But anytime you've got wear, there usually is a problem. And the question is, if you go in there and charge a lot of money and fix their teeth, and they all start breaking, you're going to be the one that's responsible. So you need a way to kind of diagnose whether or not you can control that habit. Okay, so the quick splint, and if you look at a quick splint and you have them wear that, and there's virtually no wear on it, there's probably a reasonable chance that if you again go in and establish a good central occlusion as your guidance, they're probably going to have pretty predictable longevity. In contrast, if you give them a quick splint and they get significant amount of wear in a relatively short period of time, in 2 to 4 weeks, they may have an uncontrollable grinding habit that you can't control. Now, that doesn't mean you don't restore the case, but now you know that this patient is going to be a high risk. And certainly post-operatively, it's imperative that they wear a post-operative splint or a post-operative quick splint to protect their investment. And then you got to make sure that you document your cases very well, that you've had the discussion with the patients that, yeah, I can do this, but the prognosis is going to be guarded. And a lot of the longevity is going to be really based upon your compliance wearing, protective vehicles like quick splints or post-operative splints.
It's kind of funny. I'm a show me kind of guy. And, when it comes to teeth with worn dentition, they wear their anterior teeth. And, what do patients want? Well, they want, besides wider teeth, they want to display more teeth. They want longer teeth. Well, we have to be careful when it comes to veneers, because if we lengthen the teeth, now we put our new ceramics at the same parafunctional risk that wore the original teeth out in the first place. So one, a quick splint will help prove to me that the patient will wear an appliance, because it's critical that they wear one after the fact. But two, you can actually show them the quick splint is actually just soft enough that you can see grinding and wear patterns of the opposing dentition on it. It shows up quite clearly as Gothic arch scribings on the top of the quick splint. If you really want to make it obvious to a patient, we can actually, and we will do this, we'll take a Sharpie and mark the Sharpie over these scratch marks, send them home, and then ask them to take a picture of it the next morning, and they'll see that they carved away the Sharpie. And that is a great way to help them understand what our concerns are, and they're continuing to brux, and nothing will change that.
Hi, Dr. Mike Smith from Biting Education and Clinical Mastery Series. The question is, when your patient with a worn dentition wants a new smile, are you concerned they'll break their veneers? And what does a quick splint do to prove to them that they're a bruxer? Well, the biggest thing is when you tell a patient they grind, they brux their teeth, they are always in denial. They go, oh, I don't brux my teeth. I don't grind my teeth. I don't do it at all. Well, having a medium that they can actually prove to themselves that they do grind their teeth. You can see it, you can prove it. And when they get self-reliance that, hey, this is a problem, then they're more apt to go through the treatment to say, okay, I need to protect this over time because, getting into this, my teeth got this way for a reason. And obviously that reason is I beat myself up. I smash, I crash, I bash my teeth together and they've broken back down. So as far as a reliance tool, it really helps that patient to be aware of their existing condition of they got that way because they do grind their teeth. And it's a big game changer once they get on board. Then they're going to go ahead and take care of themselves to protect what they have in there so they can keep that beautiful new smile.